we'll start with your current position, but also maybe a little bit more about you as a person. Tell us a little bit about yourself, and then we'll get to your different career positions.
Okay. So I'm Wilma Robinson. When I was here, I was Wilma Tilson. I have been living in the D.C. area since I graduated from UAB in August of '98. And I, like was said in my resume, I worked for a consulting firm right out of graduating from UAB for about 4 years and then went to work for the federal government. I am an avid softball player. I play softball. I am a dancer, singer. I like museums. You know, those are the personal things about me. But I'm very passionate about speaking to young professionals, as yourselves, and also helping young professionals think through their career journeys. And my assistant will tell you at least twice a week I'm speaking to young persons, or I'm either speaking to persons at a career change, in a point of career change in their growth and development. I always feel you should always be looking for that next thing, but still be in the moment of where you are. And so I try to spend a lot of time with young professionals to impart whatever wisdom that I may have.
Great. You are currently the Deputy Executive Secretary of HHS. What is that?
So I am the Deputy Executive Secretary. That is a career. In the federal government, you have two types of positions. Well, you have a couple of types of positions, but the main ones are career and also politicals. Those are persons that only work for that administration, that president, or that secretary for a period of time, either the full, either 4 years, full 4 years, or 8 years, and then they move on. I am what is the highest career at HHS. I am a position that's written into, my position is a position that's written into law that has to remain a career, and that purpose is for when the government changes over. I am one of the drivers to keep the government running until the next administration can fully staff. So part of what I do, all of what I do is around policy, is implementing policy, helping to implement policy, whether it be at the secretary level or helping agencies, our operating divisions, which are our CDCs, our HRSAs, FDAs, those are operating divisions, helping them to implement what they do. And so my role is a very key role, especially in a election year like now, and also after an election year, to make sure the government is continuing to run. I am a senior executive. That is a very elite group of federal workers, and the sense is that you can take a senior executive and put them in any industry and they'll be able to do just that, run. So you see a lot of senior executives that move around. They may go from health to agriculture or EPA or other, but the goal is that they provide that continuity for the federal government as things are up in the air and changes. So if positions become vacant, you'll definitely see an SES or a career employee kind of fill that vacancy until a political, if it is a political position, can fill it.
Right. I was going to ask what is a typical day like for you, but I have come to understand that there is no such thing for you. We were talking earlier, just before coming up here, that really quite surprised that you were able to escape D.C. given the coronavirus crisis. But as best you can describe what the mythical typical day would look like for you, what is that?
So a typical day for me, outside of a public health crisis, is in meetings all day, right? Like my day, I was telling Sabrina earlier that I have the best assistant in the world. I used to have an assistant that never scheduled lunch for me. So I would be meeting, can't use the bathroom, can't eat, can't. And so now I have a great assistant, and she's able to schedule all that out and be my bodyguard and keep people away at times when I do need to focus on certain things. But a lot of what I do is brokering relationships and making sure that the best thinking is getting to the secretary. Making sure people play in the sand well. I don't know if you've heard that expression. Sometimes it's herding cats, and sometimes it's just trying to think through a new law, a new executive order or something along those lines that cuts across HHS. People tend to think of HHS and then CDC and then FDA. We're all one entity. HHS is made up of 11 operating divisions, including 8 public health service entities and 3 human service entities. And also HHS is made up staff divisions of, these are assistant secretaries that are used to support the department. So a typical day for me is meetings. Under this crisis that we're currently in, which is COVID-19, you know, it's coronavirus, it's been a 24-hour type of job for me. And the only reason I'm able to be here is because I have fabulous staff, and UAB asked me about 4 months ago to come here for today, and so I was able to really plan around it. But as soon as I leave here, I'm headed to the airport to jump on a plane.
So, Dr. Robinson, we ordinarily think of responses to major disease outbreaks like this as being a response from the CDC, and we know about the EIS and the deployment of now, I think, some 1,300 CDC employees to respond to COVID-19. But clearly, you've been in the thick of things.
Yes.
And so talk about that change, that transition from your usual daily job to something that is quite different from perhaps even your own background.
So that's a good point. I've been working on COVID-19 since January 13th, and part of when you see publicly, when you hear the press conferences, when you hear the statistics, when you hear that there's a deployment of public health service corps to airports and so forth like that, that's the action part of it. But in order to get that to happen, there has to be policy that is in place to make that happen, especially when you're working across government agencies. So right now with the COVID-19 crisis, we have Centers for Disease Control. Within HHS, we have Centers for Disease Control, Assistant Administration for Children and Families, ASPR, Assistant Secretary for Public Health Readiness. You have Assistant Secretary for Finance. You have, that's just in HHS. But then you also have the State Department. You have Office of Management and Budget, which is OMB, which is the White House. You have, and now the Vice President's office, because he was just named as the head of the COVID-19. You have FAA. You have Homeland Security, including Border Patrol. And then you have Department of Transportation. So you have all these entities that have to work together to be able to address this crisis. And you have to lay out policies for that to happen. I joked one night to my staff, I was in the middle of the Costco parking lot, I'm Costco Queen, having a detailed conversation about how to collect data from FAA and the airline industry to make sure that we can track all those that have come in contact with a quarantined person. And so we have to write out those. Every time you saw a new release of frequently asked questions, that was my office, myself, and a team of folks working with CDC, working with FAA, working with OMB to bring about those frequently asked questions. To bring, we implemented, we put out an a regulation. All of us working together to put out a regulation within a 3-day period, right? So it's been a lot of overnight things. I was telling staff earlier that we have been working 24 hours since January 15th, and even on the weekends. I think 2 Saturdays ago was the first Saturday we were all emailing like, there's nothing coming. There's no COVID-19 issue for us to deal with. So the things that you see in public, you just realize that there are policies that need to be in place for that to happen. And somebody is working those policies.
Great.
And that somebody is me.
It's great to put a face to those policies. Thank you. So let me ask you about some of the previous positions you held, and then we'll circle back to your current position and ask a little bit more detailed questions. As I mentioned in your introduction, you were previously with the Office of Adolescent Health. Can you tell us more about the programs you implemented and how your MPH experience in maternal and child health influenced these programs?
So I primarily worked on two large grant programs at Office of Adolescent Health, the Teen Pregnancy Prevention Program and the Pregnancy Assistance Fund. That was about $130 million. We call them grants, but they really were cooperative agreements. We also had a huge evidence-based evaluation associated with those programs. Those programs were geared towards giving various entities, community organizations, sometimes states, money to implement not abstinence-based, but implementing teen pregnancy. Sometimes it was abstinence-based, teen pregnancy prevention programs. But for the sake of identifying which teen pregnancy programs actually work and being able to, from that, create a list of evidence-based practices that we could then flip to anybody who wanted work in this area and say that these are programs that we know work and that you can piggyback and implement it. I think when I was in school, how many people are familiar with the DARE program? Great program, right? Everybody thought it was this great program. And they probably still implement it to this day. But when we finally evaluated their program, we realized it didn't work, right? But you have millions of dollars being invested into this program that we found out from the data doesn't work. And so it was our goal, especially working any office that's in the Office of the Secretary, which OAH is. My personal belief is those offices should be working towards developing policy that could be implemented by the operating and divisions, the CDCs, the FDAs, those folks, or helping to make helping the Secretary of the White House to make policy decisions. So by identifying evidence-based practices, we're helping operating divisions to then say, here are the list of programs that you can use when we give you money, grant money, and find which ones will work in your community under your circumstance. So a lot of the work I did there was understanding grant programs, it was a great opportunity for me because prior to then I was doing research and evaluation only at a social science type level, and here I was actually working with states and communities, understanding how to implement a program, understanding evidence-based program, and that office was a kind of a change in the federal government to move to evidence-based practice. So now you'll see a lot of grant announcements and they'll say, you have to use these evidence-based practices, and that really was a turn because of that office that I worked in.
So I'm going to pause here for a second and say I counted 17, just kidding, times when Dr. Robinson used the term evidence-based public health. And as some of you know, the faculty have been working on a revised core curriculum for the MPH that utilizes the evidence-based public health framework. We believe that if indeed the MPH is a terminal practice degree, and that if evidence-based training works for the current workforce, then the framework for our core curriculum for the MPH should be evidence-based focus. So thank you for allowing me that commercial. Well, let's jump back to your current position. Talk about some of the challenges that you deal with at work. What are the things that you find most challenging in your position?
Getting people to play in the sand together. Government for years really operated in silos, right? You know, I have this program and I'm only concerned with this program, and I have this program, it's similar to this program, but I'm only concerned with this program, and the two never really talked. And part of what I do particularly is to make sure that they are talking and working together. We're not duplicating services and we're not duplicating effort, right? So I will have to bring to the table a lot of times people that don't agree. And my job is to, one, we don't want to get before the secretary arguing over a policy issue, right? So I have to work it out before we get to a meeting with the secretary. And sometimes secretary has to ultimately make a decision and get it, but I try to get that ironed out before we go before the secretary. So it's just a matter of, here's the issue, here's what we recommend, and here's where your key SMEs, your subject matter experts, fall out. And the hardest part sometimes is getting folks to agree and get out of their siloed thinking and expand their thinking around a particular subject. And then also, we often get legislation implemented. I'm familiar with the Cures Act. It was a big legislation that was implemented last year or the year before last that really looked at how we deal with mental health, opioid, substance abuse across the federal government. So it named NIH, FDA, HRSA, CDC, all the entities of HHS was involved. And when that act was signed into law, everybody was grabbing their piece because a lot of times you have laws that are enacted but no money associated. We call those appropriations. You can enact a lot of laws, but if you don't appropriate the funds, it's just sitting there and no one's doing anything about it sometimes. But this had a huge price tag attached to it, and so everybody was clamoring for those dollars. And so part of what I had to do is sit down, take that law piece by piece, figure out what in the best interest of the administration, who should handle what, and then bring them all together and argue that point and that stance and have them work together. So if ASPE wanted to be a lead for a certain section, okay, ASPE, I want you to work with FDA on that and make sure you guys are coming together and coming to agreement, and then I need you to report back to me on your progress. So a lot of the challenges is just getting people to play in the sand together.
Commercial number 2. So I think that some of that siloed thinking actually begins with the educational process. We have 5 departments. We have 5 core courses in the MPH, but and each one of those introductory classes may be very well organized, but connecting one to the other is less apparent. And so part of the work that we're doing in the revised core curriculum is to blend all of that, to make one thing feed into the other, so that when you're out in the real world, you're not going to have a problem being presented to you as this is an epidemiology problem or this is a biostats problem. It's a problem. Get out your epi skill set or your biostats skill set or whatever other skill set you need to address it. But I think that you hit on such an important point about siloed thinking.
And then also, I think another area is when you have team projects and you're working together. I failed miserably while I was here on team projects. Well, at least my first team project was the lesson learned for myself. It was a healthcare organization class or a healthcare policy organization class, and we had to work together as a team to come up with a policy, but it meant us traveling to Montgomery to look at, I think it was the maternal child health program there, and reporting back. And my team, I felt like they were lazy and they were not contributing, so I just did everything myself. And then I went to the professor when I came back to class and I complained about how lazy my teammates were. And he gave me a B and gave them an A on that project. And I was like, huh? But I failed miserably at the lesson of learning how to work together. It is not one person. And somehow in your team relationships, you have to learn how to bring the best out of your teammates and also work together. And that's a lesson that transcends into the real world.
I hope you heard what she said. I really hope you heard what she said. Do you do anything completely by yourself?
No, nothing. The reason I'm here is because I have a good team at home.
There you go. Let me go on to ask you a couple of more questions about your current position. In the introduction, I mentioned in specific that you helped resolve complex technical issues that HHS may face. Can you elaborate on that?
So one I mentioned already was the Cures Act. That act had I don't know how 400 and something sections in it, and we had to dissect each section and share it across the agency. we don't do that for every law, but just the laws that are cross-cutting. So if a law specifically mentions the Center for Medicaid Services, then they work directly to implement that law. But if it mentions Center for Medicaid Services, CDC, FDA, so we have to work through those. The other is the COVID-19 crisis that we're going through now. I emailed my staff this morning because Nashville just had tornadoes. And I said to one of my managers, have you received a public health emergency announcement? Are there any talks of a public health emergency announcement from the Secretary or the President for Nashville? In the midst of COVID-19, in the midst, we still have an Ebola crisis in Africa and the DRC, right? So all that continues to go on. That doesn't stop. You have to continue to work those various things. And we're in the middle of regulation season. Right now, we're working on what is called the Spring Unified Agenda. The federal government announces a preview of the regulations that they intend to do twice a year. One is in the spring, one is in the fall. And right before I left yesterday, I was briefing the Deputy Secretary on our spring agenda that we're turning into Office of Management and Budget for the coming spring. That will be out in May. So you still have to maintain the day-to-day and deal with these things that pop up.
Back to the issue of challenges, and we talked about this earlier. You were hired under the Clinton administration. You spent time during the 2 terms of President George W. Bush, then 2 terms of President Barack Obama, and now almost 1 full term of President Trump. How have you kept your job is one question, but how do you remain apolitical and do the work of public health?
So one thing I try to say, if you don't know who I am, then that is a good thing. That means I'm doing my job and I'm going underneath the radar. So far in this administration, I've only had 1 political article written about me, and that was at the very beginning because I had to be the one to sign and pull back the Obama regulations that this administration had rolled back at the beginning of the year. So that is a great thing. But the main way is, 1, staying out of the news, not doing anything illegal, and 2,
The basics.
that sounds like it's the easy thing, but when you're not a government employee and you come into government, you don't realize what's illegal and what's not. And so part of what you have to do is first understand that everything I do, I run through our ethics department to make sure that I'm not doing, even coming here, I ran that through ethics to make sure I'm not doing anything illegal. But the other part is really focusing on what you're doing and not who you're doing it for. And for the most part, under the Bush and the Obama administration, it was the same programs, just different names and flipped to other, changed, maybe a smaller set, and nothing is drastic. This administration has been a little bit different than the previous administration, but the goal has really been to kind of focus on the programming and the intent of helping the American public. That translates in different ways under different administrations. I try to make sure that I give the best thinking, and because my opinions are valued, when I do feel like something is going down the wrong path or we shouldn't do it that way, I have the ear of senior leadership, and they are able to assess that, okay, I agree, and try to move it in a different direction if they can. So I think part of it, a lot of us are passionate about some things. Some of us are passionate about everything. The biggest thing you have to learn coming out of a program is knowing when to be passionate and when to work within the political atmosphere to move your agenda in a certain way. So sometimes you can't be the loudest one in the room. Sometimes you have to be the quiet mouse that makes people move into the corner because they're scared, right? Move into the corner, but get them to go the direction that you want them to go. And I think if I impart anything on you is that, you have to understand how to work in a political world that we live in. Even in Alabama, there are some political ideals that keep you from doing certain things, and you have to kind of get people to follow you or get people to kind of follow your way. And I think women do this well. We kind of get men to do things we want them to do, and they don't even realize that they're doing it. And
Really?
So,
No. Now, you just now telling me that?
you make them think it's their idea, and then you get those done. So you have to kind of figure out how to do that.
Yeah. And I no to your point, I'm sure that Dr. McCormick, Dr. Wingate, and other staff in the room face these kinds of political challenges, as you alluded to with Alabama, and the work of public health has to continue on, and we try to engage while still being apolitical, and that's a challenge. It's a large challenge.
It is. Sometimes you have to go home and cry, right? You can't do it at work. You can't yell and throw stuff at the TV. I have a TV in my office at work. You have to kind of internalize that and leave it all in the office so that it doesn't translate into your home life. But yeah, it is challenging at times. But
Let's talk about your time here as a student. What are some of the experiences or opportunities you participated in here at UAB that made you successful in your career? You mentioned one of those
Yes.
earlier.
I think one, I was at a different, when I came in '96, a lot of the schools of public health were not taking students right out of undergrad. They were only looking at potential students that had at least 2 years experience in public health field. So I got rejected by Columbia, Chapel Hill, a whole bunch of other schools, and I kid that when they asked me to come speak, like, yeah, you didn't set me in your program. But UAB took a chance on us, right? It was a core group of us, about 25 students that didn't have that experience. We were straight out of grad school, so it was new. We didn't know what public health was. A lot of us had wanted to go to med school and for whatever reason didn't go. My reason was I realized I didn't like blood and didn't think I would be a good doctor if I couldn't deal with blood, and plus I'm very empathetic, so that wouldn't have worked. But public health was new to me, and UAB took a chance on us, and it ended up being the best decision I've ever made. I realized that I could help people not deal with medicine, but help people in ways that are impactful, just as impactful as medicine. I think what I learned from this school has been invaluable. I mean, I've learned so much on just how to do day-to-day things. The other thing is that I grew up in inner city New York. I was one of those people on aid for children with AFDC, which is now TANF. I was a ward of the state. My grandmother raised me. And coming in school public health, especially in the policy world, and hearing about the programs that I actually lived, I was on Medicaid, it was like, wow. And I can tell them why it didn't work, why it was such a problem for me to do this and do that and do that. And it really it brought to life what I had experienced growing up in New York City. And I think UAB prepared me well for life. And I think the mentor relationships were important. I was able to, UAB is a research school, so I was able to work on a number of research projects. And I would encourage that if you haven't gotten with a professor and identified on a research area that you like, even if research isn't your thing, it does open your mind up to how something can be implemented, even on the policy side. So I would encourage that. But I think those were kind of the nuggets that I took away from UAB.
What about particular skills that you gained at the school that prepared you for your career?
Teamwork, I already said I learned that lesson the hard way. And I didn't like going, even at Emory, I was scared of data, even though I did all the math, I did organic chem and all that stuff. But coming here and taking biostatistics and epidemiology, it opened a world of thinking for me. I shared this story earlier. I was in a room of health professionals at HHS. I was very young in my career, so I was sitting on the outskirts of the room and all the official people were at the table. And there was an outbreak in probably early 2000 in Georgia of syphilis. And CDC was at the, I don't even think CDC was at the table, which now it doesn't make sense. But it was all these high up people in public health, and they were trying to figure out what was going on in this area of Georgia and the public health in me. And I remember that epidemiology class, and I remember how we assessed and traced how a disease or an outbreak can happen and how you have to go back to its origins. And they were trying to figure out what was going on because the outbreak occurred in a county that had multiple high schools, and these kids were upper middle class white students from different high schools. And how were they all contracting syphilis? And I just remember, like, what could a child be doing that can allow you, no matter where you are or what town you're in, to contract a disease? And I was like, sex parties. And when I said that at the table, and they were like, oh, what do you mean sex parties? And I was like, well, in public health, this is what we did, and I had explained to them. And it just opened a whole new world of thinking. But I learned to assess that at UAB.
Fantastic. By the way, there's a Frontline documentary on that very outbreak. It's fascinating study. Let me ask you this about your sort of circling back to your current position. Your MPH is in maternal and child health. You frequently deal with Congress and policy. How do you think your MPH helps you in thinking about how to engage with Congress?
So in my current position, we have an agency within HHS that deals, Office Assistant Secretary for Legislation. They actually deal with the day-to-day to Congress. The way I deal with Congress is responding to their inquiries and helping with the policy. So they don't know they're talking to me. They think they're talking to the secretary. But I'm the one that pulls together the thinking and making sure that a response goes up that meets this administration's ideals and directions. But the way that UAB has prepared me to deal with that is just understanding policy, understanding different perspectives. And when you think of a congressperson or congressman, they are representing a state, an entity, an area, and so that's their concern. And so when we're here at UAB and we're taking the policy classes and we're trying to put together the policy analysis and the thinking and all that, assessing where this congressman is coming from. So, for example, with COVID, we had a congressman write a letter about this is wanting. And it wasn't a congressman, I'm sorry, this is state officials, a delegation of a state. I'm not going to say which states. But they wanted us to preemptively say how much money we were going to give them to deal with this crisis. In the middle of the crisis, right? Hadn't even gone to those states yet. But they wanted us to say, like 9/11, we put a huge price tag on monies that we gave to the states infected. And they wanted to ask us ahead of time, give us this money. How much you're going to give us to deal with people in our own state that are from our state with the crisis. We're not talking about the states that we placed persons. And so just understanding the perspective where they come from. Ideally, they're trying to figure out what's best for their constituents. Sometimes it's on the greedy side, but sometimes it's really on the consumer, just understanding. And I think UAB had prepared us to kind of step back and really look at what's at hand and what's in the front of us and dealing with it.
So I'll ask you one more question and then turn back to the audience here. How do you break in? How do you get that first job in the federal government?
So how I got my break into the federal government was it was kind of like at this period of time. Whenever there's a change, when there's a potential change in a federal government, change in administration, so an election period, November election period, not the presidential election period, there's always a push to fill any vacancies that you may have, because should the government change over, so should there be a different president come November, in November or December, they're going to put a freeze on hiring because they don't want the previous administration to put all their people into that administration before it changes over. And so that period between July, August, and September, you'll see a lot of vacancy announcements. And so I think that's a perfect opportunity to apply. There are also what we call recent grad announcements, and it doesn't get you into the government permanently, but it does get your foot in the door and allow you a 3-year period to build relations to be able to get a permanent position. But I think, one, there will be more job announcements during that July and September period, so that's a period to look. USAjobs.gov is the site that you go to for all federal jobs. And then just applying to fellowship programs. The Presidential Manager Fellowship Program is a good program. I think they start that process in the fall. So if you're just starting, that's a program to look for in the fall. Also, ORISE Fellows, which is a kind of a consultant type job where you work for ORISE, but you go to work. It's like an internship program. You're not a federal employee, you don't get all the perks, but again, it allows you to build the relationships to be able to hire. I've hired ORISE fellows when I was at OAH, and I hired 3 ORISE fellows, and all 3 of them are federal employees now. So it is a way to kind of get in.
Right. And that acronym is ORISE?
Yes.
Oak Ridge Institute for Science and Education, I think.
Yes.
And Mina, we were at CDC last week, and some of the people with whom we were talking gave us a single website where a lot of these fellowships were listed. Was that cdc.gov/fellowships?
Yeah, if you go to the CDC website, they redesigned it, and you look at the top, it'd say opportunities or something like that, and it'll be under that. Also, if you go to the hhs.gov website, there's a section that says programs, either about HHS, it says programs and services or something like that. Under there is education and training, and they list all of the education and training opportunities across HHS, not just CDC, but NIH, FDA, and the cycle. If you're looking at internships, the best time to start looking at internships for the federal government is in the fall, kind of October, November. If you wait till January, it's almost too late. Those slots are already taken. That you wouldn't start till that summer, I think January is often too late to start looking for internships with the federal government.
Well, I said that was my last question, but now I'm going to one more. Do you offer an internship for someone to come work with you?
Don't offer internship, but I am the boss, and if there is a good student. When I was at OAH, I was a practicum advisor for a number of universities, and so I did allow students to come in. I think if I did run, because the office that I sit in, we deal with a lot of confidential proprietary information. For example, I have to fill out financial forms every 15 days because I deal with information from CMS that the public that they may not be aware of, and that if I was to buy stock or something under that. And so I think with my boss, the executive secretary, that has been her challenge of bringing in interns with the fear that how we run things, may not be kept confidential. So it is kind of hard for me to have an internship, but I do have connections with almost every office in the department and be willing to help out UAB students.
Do you have any tips for managing imposter syndrome?
I'm familiar with that.
Where for me, I would wake up believing that someone is going to find out that I'm really not qualified to be the dean because I'm really not, and they're gonna.
Well, there's a lot of that going around in the world.
I'm convinced that I'm really not, and we have this tendency to think we're not really good enough.
And I think we had this discussion a second ago, so I'll use this story and maybe it'll help you. Before I moved into management, my goal in life, and in the federal government, you range from a GS1 to a GS15 as a career, and then senior executive service, where I am, is the highest level in federal government. And I moved up fairly quickly. I started in the federal government as a GS-11, and fairly quickly I moved up to a GS-14. So my goal in life was to be a non-supervisory 15, meaning I get that 15 money, but I don't have to manage anyone. That was my goal. I didn't want to manage people because the higher you get up, the crazy they are, right? So my goal was like, okay, I don't want to deal with that. Especially PhDs, that's a whole nother level. You don't realize how crazy your colleagues are until you manage them. Brilliant people, but just maybe not the best to manage. And so I was offered a position to head up a division within my office. It wasn't the division that I worked in. It was a division that was being headed by a lawyer at the time, and that lawyer moved on. And of course, I wasn't a lawyer, and at that time, I didn't even have my PhD. They asked me, and the head of my office came and said, Wilma, I want you to act. I had been running the CHIP evaluation, which fell under that division, so she felt like I would be a good fit to manage that office. And I said no. One, because I didn't think I was qualified to do the job because a lawyer had handled it before. And I said no. And then my boss left, and they asked me again to ask, my immediate supervisor, and I said no. And then she closed the door and she said, Wilma, I think you will make a great manager, and that's why I keep asking you. And I was like, okay, but no, because I wanted to non-supervised 15. That was my goal in life. And another lady, Lady Bush, she heads up another division, and she pulled me in the hallway one day and she said, people see something in you, and that's why they keep asking you. And if anyone asks you to act, you should act, and even for however short period of time it is. And I said, okay. And so they came back again and asked me, and I said yes. And I was an acting manager, meaning I went from not managing anyone for 3 months. I was an acting manager. I told this story. They didn't give me the job because the manager actually told me that he felt like I didn't have the analytical capacity to do this job. And he shouldn't have said that to me. The New Yorker in me, I didn't curse him out or anything, but the New Yorker in me made me say, I'm going to prove this man wrong. And after that 3-month period, I was asked to be a director. That means I skipped several levels of mid-management and went into a director. I stayed as a director for 4 years and moved into SES. And there are only 2 ways to go in SES.
SES is?
Senior Executive Service, which is the highest level of federal government career. And even political is the highest level. There are 2 ways to go through a candidate program where you go through 18 months of education, or you apply to a position. You have to go through a leadership application that you submit to OPM. So you can get the position and still not get the job because OPM says you're not a leader. Not only did I get that job without going through a candidate program, I completed my application period for leadership application in 2 weeks, which is almost unheard of. It's a 3-month process. And they even said it was the best application that they ever saw. That I only had to do it one time. I didn't have to redo the question. But here I was all those times saying, no, I'm not a manager. Why are you coming to me? And I was doubting myself. So I think if someone asks you, or if someone is giving you the opportunity to apply or receive a job, they see something in you. Whether it's fully developed at the time that you get the job but your responsibility once you get the job is to learn and to grow. And the smartest thing you can do is put smart people around you, right? I built a staff of very intelligent people around me to help me. I don't attest to know everything, and I use them. I bounce ideas off of them, and I use them, and have been able to turn around my office before you. So I guess the best way to deal with imposter syndrome is to have confidence in yourself. I said this earlier. You're in a master's program. You're a master's of public health program, meaning that you're a master of something, right? Be that master of something. Figure out what your niche is, what your area of focus you want to be, and become a master in that area of focus. Don't be one-dimensional, of course. Keep those skills that I mentioned earlier going, but make sure you're an expert in that. And an expert is someone who is continually learning. You see Dr. Fauci, and I love Dr. Fauci. He's like one of the brilliant minds of our day. And he called me on the phone one day, and I was like, oh my God, it's Dr. Fauci. But he is always learning, always growing, always moving forward. And part of that career development and always assessing where you are career-wise is continuing to grow. And I tell my staff, 3 to 5 years max in this position, that's what I expect you to be. You should always be building your resume. You should always be thinking about the next, be present in the job that you're in, but don't ever have a time period where somebody has a job opportunity for you and your resume is still 7 years old. And so you're always constantly developing and preparing yourself for that.
Well, Dr. Robinson, we don't doubt you. And we want to thank you. Please join me in thanking Dr. Robinson.